Hello viewers, I am Professor Dr. Sheikh Nurul Fattah Ruby, head of the department ENT and Head Neck Surgery Department, Dhaka Medical College, Dhaka, Bangladesh. I welcome you all in the MediTalk. Now today we will discuss about the problem of nasal blockage or nose block. Every people, sometimes we feel at any time, sometimes our nose is blocked. We should not be afraid too much of nasal blockage or nasal block, because sometimes it is quite common, nose block. If you think, medically we have some inferior turbinate, we have two nostrils on two sides, there are nasal inferior turbinate, middle turbinate and superior turbinate. These turbinate are normal structure in the nose. Sometimes when we get cold, upper respiratory infection, this becomes a bit swollen. Or when we feel any problem from allergic problem, there will be swelling of the nasal mucosa as well as swelling of the turbinate. So there will be the problem of nasal blockage. What we can do? If you see the nose is blocked, sometimes we may feel problem of breathing. In case of nasal blockage, sometimes we take air from our mouth, so our mouth will become a bit dry. And if the nasal blockage persists, then we may get problem of the sinusitis. Sinusitis is also a problem from the sinus. So what to do? When you feel nasal blockage, you try to relieve the symptom by how? You take some simple measure. Suppose you take steam inhalation. You just have warm water with the vapor coming. You take the vapor or steam through your nose 10 to 15 minutes regularly thrice a day. You will feel a bit clearer of the nose. Even you can give some, you can clear your nose by nasal irrigation or nasal by giving some warm water into your nostril. Just you take some warm water, you put it through your nose. Like this way, you will feel nasal blockage a bit less. Besides this, we have to decide actually what is the problem for nasal blockage. If this is simple, but there may be deviated nasal septum, this may cause your nasal blockage. There may be nasal polyp, this may cause your nasal blockage. So you have to find out the cause. What is the cause behind the nasal blockage? Very common cause is deviated nasal septum, hypertrophy of the inferior turbinate, and also the nasal polyp. Another disease, we call it a rhinosporidiosis. It is quite common in Bangladesh, India, Sri Lanka. Rhinosporidiosis is a fungal disease. There may be a fleshy, reddish mass in the nostril, in the nasal cavity, which bleeds on touch. It looks like a strawberry appearance. Then we have to treat the disease. Then nasal blockage will be cleared. When you have a problem with the nasal deviation, septal deviation, straightforward, please don't go straight forward for the operation, because septal deviation is common, quite common. 40–50% people has deviated nasal septum, but they don't always feel problem. Sometimes they feel nasal blockage. In that situation, you can use the nasal drop 3 times, 3 drops, 3 times daily. It will help you. And you can also use some antihistamine tablet. Warm water. You take warm water and clean the nostrils, and you have to take the steam inhalation. It will help you. But sometimes you need definitive medical treatment as well as very less chance of surgical correction. We'll discuss about the surgery in another day. Thank you very much.